The answer for this question is option C, scrofuloderma. Scrofuloderma, it is a cutaneous manifestation of the tuberculosis. So in the question, history of tuberculosis is important, and this occurs due to the direct extension from the underlying lymph nodes, bones or joints. And here you can see that the patient is having the multiple discharging sinuses and ulcers, which are very classical findings of scrofuloderma over the neck and the axillary region where there are going to be lymph nodes. And there is also history of previous painless swellings, and they are ulcerating and releasing caseous material. These are also in favor of scrofuloderma, and also skin can show the changes that is in the form of scarring. So coming to the other options, so if you look at the other options, lupus vulgaris, please remember this is the most common form of cutaneous tuberculosis in the adults, and this is a post-primary form of the cutaneous tuberculosis. It slowly grows in the form of a plaques, and on diascopy we can see apple jelly nodules. TBVC, it is tuberculosis verrucosa cutis, so warty lesions will be present over the skin and there will not be any discharging sinuses. Actinomycosis, it is a bacterial infection which can cause multiple sinuses with sulfur granules. But the history of tuberculosis does not make any sense for actinomycosis. So the answer is scrofuloderma. And remember, scrofuloderma is the most common type of cutaneous tuberculosis in the children. So I hope this video helps. Thank you so much. Happy learning. Bye-bye.